Yes, I'm Dr. Thind from Thind Eye Hospital, Jalandhar. Nobody want to use glasses, maybe for it is distance or for near. And if you are a candidate and you don't want to use glasses, yes, we are here to suggest you the ways to remove your glasses. Basically, there are two types of procedures they are being followed. One is cornea based, the other one is lens based. Cornea based procedures, most of the people they know about it. That is, most common procedure is LASIK. Then there is SMILE and laser based other procedures which were prevalent before. It is PRK and LASIK. And different names have been given to it. Maybe it is customized LASIK, maybe it is dioptrics, contour vision, topo-guided LASIK, and all those procedures are really prevalent. The other procedure is lens-based, where we put an extra lens inside the eye to correct your eyesight. That is called ICL, implantable convex lens. Or we remove the natural lens and put another lens inside, that is called intraocular lens implant. So these lenses are also very much prevalent nowadays. Today we will be talking about the lens-based procedures. Lens-based procedure is really good and it is in the being for last almost 25 years now. We started using ICL in Thind Eye Hospital in 2001 and we were the first to introduce ICL in India. To begin with, ICL was just a cranial ICL. Then in the coming years, Toric ICL came in, where we can correct the astigmatism. Advantage of ICL is that it can correct the power up to -20. Even few lenses are available where we can go beyond that power also, and we can correct the astigmatism also. And this procedure is reversible, or if your number changes even after that, we can exchange the ICL. The other advantage is that your cornea is untouched. Means we do not remove anything, we are just adding something in the eye. Once we put lens inside the eye, it supplements to the power of the natural lens and gives you a clear vision. And it is near to the nodal point of the eye. The quality of vision is better. And the complications of LASIK or laser correction, they are taken care of. Once we are not changing your cornea, few measurements that we take on the eye, in coming times, they are very important for everybody. They are not affected. Like in case you develop glaucoma, the IOP measurement means intraocular pressure measurement, it is not affected. It would be the actual pressure that is there in the eye. Otherwise, after refractive procedure or laser refractive procedure, we have to correct it with some magnitude according to the thickness of the eye. Once you develop cataract, again, biometry is affected, so we have to take into consideration that your refractive procedure has been done. With ICL, all these things are taken care of. They are not affected. So ICL is a better option. To begin with, we were using ICL in cases every patient is not fit for ICL. We investigate the eye thoroughly. Only then we will let the patient know whether ICL can be done or not. Myopia or hypermetropia. Both the things can be treated. Even now we can correct your presbyopia also with ICL. Myopia is a very common condition that is being corrected with ICL. Even hypermetropia, if your anterior chamber depth is normal, we can correct it. Usually we do ICL after the age of 18, 19, 20. But in case where there is anisometropia, means there is a difference in the power of both the eyes that is beyond 5 diopters, and child is not able to use both the eyes together, or the child is developing amblyopia or laziness of the eye, we can do ICL procedure even before, so that both the eyes could see together and brain could fuse the image seen by both the eyes. So the advantage of ICL is manifold. In case of keratoconus, patient has to use glasses all the time. Even then the quality of vision is not good. If patient doesn't want to use glasses, we can use ICL. It can be plano or it can be toric also, to give him independence from glasses. In case patient has gone for cataract surgery and there is a residual power and that cannot be corrected with laser, we can implant the ICL in pseudophakic patients also, where patient gets independence from glasses for distance, and it can be for near also. This lens is very commonly being used all over the world, and ICL has got FDA approval also. Means US FDA approval gives the legitimacy to any of the lens or any of the modality to be used in human eye. But even in India, it has got the approval where we can use in all the patients who are eligible for it. Over 2 million ICL procedures have already been done world over, and our hospital has done more than 7,000 ICL procedures till date. Then comes the question of how much time will it take? Is it painful? What is the recovery time? If your eye is fit for ICL, the procedure takes hardly 5 to 10 minutes for both the eyes, and next day you can resume your normal work. In a couple of days you can do everything that you want to do. And we always say that yes, don't let soap and water into the eye for maybe a couple of weeks. After that you can resume any activity that you want to.